It's December 14, 2023. I'm Dr. Deuk Majin. We're at the Deuk Spine Institute getting ready to start our last surgery for the day. This patient has degenerated discs at L4-5 and L5-S1. AP. She also has a spondylolisthesis grade 1. She has a very lordotic spine, an unusual contour. Okay, so it's too lateral. We need to go more medial. Shot. So the first disc we're aiming for is L5-S1. Shot. Just below where the tip of the needle is. I'm going to try to go, I may have to do 2 incisions. Let's see what happens here. Shot. She sleepy? Yeah? All right. Shot. Let's go with an AP view. Let's see where we are. No. I mean, if she's sleeping, it's fine. I think we're far enough away. Let's see. Henry, show us the video on why do herniated discs cause so much pain. Okay, welcome back. We've now gained access to the L5-S1 disc that's damaged through the foramen on the right side. We're trying for the L4-5 next. Not bad. Let's go back to a lateral view. I was just commenting that I may have some difficulty accessing both discs through the same incision, only because the shape of her spine is so abnormal. Shot. And what I mean by that is she's extremely lordotic. Shot. Lordosis is curvature, and it's normal to have some curvature of your spine in your lower back, but hers is extreme. And honestly, I think that's been a contributor, shot, to her problem. How she developed such a significant disc issue. Shot. Now I'm hitting all the bone right here that, this bone is from all the arthritis that she has going on at L4-5. Shot. I got it. I'm going to have to manipulate these needles. Shot. 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 Getting closer. Let's get an AP view. you can see the listhesis at 4-5. That's L4, L5. So this patient has a multitude of problems, but her pain is coming from the disc injuries at L4-5 and L5-S1. That's why we're here to fix those discs. Not too bad, actually. I like that. Shot. 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 All right, let's see where we are there. I'm right at the back of the disc. If I can make this work, it'll be wonderful for her. It looks like it will work. That's great news. Do you think we can get a discogram? Yeah. How long has she had back pain for?
3 years? 20 years.
20 years. So intermittent for 20 years, and the last 3 years it's constant. All right, so she's had lower back pain for 20 years. Think about all those years of good quality life she could have had if this pain wasn't there. And then over the last 3 years, it's gotten a lot worse. Now, when I asked her, where is your pain? She showed me on our telemed right in this area, right? So I looked at her MRI and she had 2 damaged discs here, L5-S1 and L4-5. How is she? She ready?
How are you doing? You okay? You okay? We're going to ask you a pain score, 0 to 10.
10 being the worst pain of your
Give
life.
us a number. That's all you do.
All right?
Very simple. Like
Are you having any pain right now?
Are you having any pain? No.
No. How bad is that on a scale of 1 to 10? How high does it go?
Scale 1 to 10.
What's the highest it went?
Give us a number.
Still too sleepy. All right.
Can you give us a number?
What number? 6?
What's the highest it went?
Was 6 the highest it went?
10? 7?
And what was this one? What number is this one?
I just heard her say 10, 10. Is that where you get your pain?
Yeah.
I know, it's hard to hear. Is that where you get your pain?
Where you normally get your pain? Yes or no?
So we got 2 discograms. She's still a little sleepy, but let's go ahead and put her down.
We're going to go nice and slow.
Take your time.
Really
So
slow.
both discs were causing her pain. One was a 7 out of 10. Which one was that? 4-5? And then 5-1 was a 10 out of 10. But I think the 4-5 is higher than a 7. I think she's just too sleepy. So that's okay. We were even talking about not waking her up to do this, but we decided to go ahead and do it anyway. All right, shot. Luis, will you hold this here? Mm-hmm. Shot. Any questions, Henry?
No current questions.
I'm taking the needle out. Shot. I'm leaving the guide wire. Our first disc we're going to treat is going to be 4-5. Now I'm going to place the dilator over the guide wire. Remember, we've created a safe path. So normally I would never just stick a dilator down to the spine, but because we have the guide wire to guide the dilator where I want it to go in a safe path. I'm okay doing it. This is not the only surgery in the world that uses guide wires.
You just can't give too much.
Take your time. She's not really responding, which is good. All right, we're going to start with the L4-5. And we're now with the dilator at the very back of her disc. I need to advance the dilator into the disc. And we're going through that tear. You guys can actually see the tear. Go ahead. It's a huge tear. You see how easy the dilator went in? That tear is where her pain's coming from. The tear is where the herniation came from. So the herniation came out of the tear, and that's where her pain's coming from. Shot? Let's pull back just a little bit. Shot? Shot? That's good. All right, Henry, let's show the audience how this procedure actually fixes back pain. Welcome back. Now you see how the Deuk laser disc repair works. This patient's disc here at L4-5, you can see it's quite fluffy so far, meaning that it's a newer part of the herniation. When you get a lot of scar tissue, that's when you know you're in the older part of the herniation. This is a newer part. We'll be fixing two damaged discs. One disc has a herniation with a large annular tear. The other one is a herniated disc, but also spondylolisthesis grade 1, which is a slippage of one bone on the other. So it turns out that chronic back pain, which is pain lasting more than 6 weeks in your lower back, it has specific causes, okay? And those causes, there's 30 of them. We've identified them at Deuk Spine Institute. They include the discs, the facet joints, the sacroiliac joints, the piriformis muscles, the bones, called vertebral bodies. And if you look at all these causes, the most common by far is the disc. The discs are the most common cause of back pain. 85% of chronic back pain comes from a disc injury or two. It turns out that there are 2.2 discs on average per patient that are causing their back pain. By the time they get to us, 2.2 discs. There's a herniation per patient. So on average, we're fixing 2.2 discs per person. In her case, we're fixing 2. Turns out that About 9% or 10% of back pain comes from the facet joints, F-A-C-E-T, which are located behind the discs. There's a right and a left facet joint. Between the discs and the facets, that accounts for 85 plus 10, which is 95% of chronic back pain. The other 5% comes from the sacroiliac joints, piriformis muscles, and occasionally the coccyx, little bone at the bottom of your sacrum, your tailbone can be inflamed, and fractures of the spine, what are called osteoporotic compression fractures. Of course, this is all comers for back pain. We're not talking about patients that come to the emergency room. We're talking about the ones that come to your clinic, outpatient. There are, of course, tumors, infections, and trauma, motor vehicle accidents as well. They can cause back pain from trauma to the spine. But that's, again, less than 1%. So by far the most common cause of back pain is a bad disc, an injured disc. And we call it an injured disc because injured discs have many different names. There's herniated disc, bulging disc, ruptured disc, protruding disc, extruded disc, slip disc, degenerated disc. They all refer to injured discs. All right. This patient's disc injury, to me, seems somewhat new so far. What we're seeing is a lot of fresh herniation, the blue stuff. Fluffy blue. Any questions?
No current questions.
She doing all right?
Yeah, I think so. We're just looking at the IV.
All right, we are almost done with the first disc. And we'll be moving on to the second disc soon. And again, I'm quite surprised, given all my experience fixing these discs. I thought this disc would be far more degenerated than it is. It looks like a more recent injury.
We have a question.
Sure.
This comes from Canes25 on YouTube.
Just before I say anything, Keynes, look at the tear right there. You see the blue? That's the herniation stuck within the tear. The white stuff is the annular fibers that are torn. And the actual blue is the crack of the tear. Yeah, it's kind of cool. Yeah, sure, we'll take Canes 25.
Canes.
Thanks for asking.
Canes asks, Doc, my dad had some rare cervical nerve damage problem where his eye waters intensely and burns. Can you tell me about this? The doctor said it was the first time he's seen it in all his years, but something about the nerve was hung up.
Well, Canes 25, I have to say, knowing everything I know about the brain and spine and nervous system, which is a considerable amount, the only time you get an eye that waters up and tears is if you have maybe an injury to the cornea during the surgery. So if the eye was exposed, dry, he could have had a corneal laceration. So you need to see an eye doctor and get that checked out. There could be a tear in his cornea. that would be causing that, especially if it's painful. There is no spine injury that would cause your eye to water, ever. Now there is a Horner syndrome, Horners, where you can damage the sympathetic trunk in the cervical spine during surgery, and you're going to get, if you look up Horner, Horner, Horner syndrome, you can get that, but that's not a tearing eye. So, and there's definitely no eye pain. So I think they must have caused some type of a corneal laceration during the surgery. And again, they're most commonly due to not protecting the eye properly. But it happens, you know, it's a known risk of anesthesia and surgery. So if it's a discomfort, any discomfort whatsoever, and it's tearing, he needs to see an ophthalmologist right away and look for a laceration.
He said, Canes 25 said, he said only hope it heals on its own, but it's been over a year and it hasn't. And no, doc, he said it was from a cervical, never had eye surgery.
No, I'm not saying he's had eye surgery. What I'm saying to you is a patient whose eye is open, it's left open accidentally during the surgery, will dry out and it can get lacerated. They can rip the cornea, which is the covering over the eyeball, and that can cause irritation of the eye, chronic, and it can cause tearing and pain. And that's what I'm telling you to go get him checked for. Not that he had eye surgery, but that the spine surgery, during the spine surgery, they left his eyeball open and it dried out and ripped the covering over the eyeball. Okay, it's called a corneal laceration. Happens. If that's the case, you know, let me know. But it shouldn't happen. But we know that it does happen. Okay? Has nothing to do with the spine. Has to do with just the eyeball drying out during surgery. There's nothing you can do in the spine that would cause an eyeball to tear up. Now, there's a headache you can get called a cluster headache that will cause the eye to tear. Okay? You can have a blocked nasolacrimal duct where the eye drains into the nose. It could be blocked. Okay, blocked up. My dog has that, and he's always tearing, right? And that could be it. But my advice to you is go and get his eyeball checked. If there's any pain or discomfort on the eye, then it's a laceration. That's what's happened, a laceration. You just need an ophthalmologist to check him out. They'll put a dye on his eye and they'll look for it. All right, just about done. 30 seconds. This is the last of the herniation here. Quite interesting. How's the laser working? Good?
Yes.
Which number is this? 5, 6? You guys doing all right? So for that tearing, Canes 25, you got blocked nasolacrimal duct, you've got corneal laceration, and which needs an ophthalmologist to diagnose. And then you've got, I don't think he'd have a cluster headache, but that can cause tearing of the eye. I'd start with the ophthalmologist. And I hate to say it, but you know I've said it. Doctors a lot of times cover up their mistakes. That's why we video our surgeries, so I can't cover my mistakes. You guys can see my mistakes. if I make a mistake, which I try not to. Ten seconds. That went really well. Better than I expected. Let's see, there's the nerve right there. You guys see it? That white thing?
Yes, we do.
That's the nerve. Some scar tissue on it. You guys see the strands of scar tissue, the white stuff, like strands? That's from the inflammation in the disc that we just took care of. So you can see the scar tissue on the nerve root itself from chronic inflammation. That's why you don't want to let your inflamed herniated disc keep going, because it creates scar tissue. And that can actually get onto the nerve. Scope off. Anybody see the new Wonka movie yet? Is that out?
Tomorrow.
Tomorrow? You're seeing it tomorrow or it's out tomorrow?
No, it's out tomorrow.
Oh.
No, I'm gonna be in Las Vegas tomorrow.
You're going to be in Vegas tomorrow? You?
Well, in yours Vegas, right?
Huh?
The Christmas party is gonna be.
Oh, right. The Christmas party. Casino night.
Yeah.
You going to be there? I'm not going to see it. No, I'll wait till it comes out on Netflix. I like Willy Wonka. I like the Johnny Depp one. I like the one before that with Gene Wilder.
Yeah.
You know. But I don't know about this new one. I don't know why they need to make another Willy Wonka. I mean, the other ones were really good. I thought the Johnny Depp one was pretty phenomenal.
Agreed.
Between the original and the Johnny Depp one, I think that covers everything. What else can you do? So I'll probably see it, but yeah, I just want to see what they're going to do. You know, they seem to muck up these movies pretty lately, you know, with the new versions. Okay, we are going to go down and fix L4-S1 next. Shot? Of course, yeah, we're happy to do that. You have to put another quarter in the anesthesia machine.
Extra quarter in the local machine right now.
Shot. Let's put some num-num. Make Dr. Berndes happy. Shot. Wonderful. That's it, Jordan? This is a tough one because the angle is so steep. So steep. You guys see that steep angle? Holy moly.
Gotta keep your arm still for me.
You're doing great. Shot? Yeah. You're doing great.
Hang in there on the last one for you.
Last one. Uh-huh. Shot? I don't want the tip to go any further. I mean, it can, but I don't want it to. Shot? Where do you think the collar is? Right there? I see it. Shot? Yeah, perfect. Alrighty. Well, it went better than I expected. It's a tough one. You guys see the angle here, Henry?
Yes, we do.
Normally this tube is like this, you know what I mean? But this thing is all the way pressed up against her because the angle of the disc determines the angle of the tube. So, and this is a much harder surgery to do. But don't move, you're doing great. We're almost done. All right. Give us 10 minutes and we'll fix your life.
That's all you got.
You hear me? You like that? Give us 10 minutes and we'll fix your life.
That's going on.
I liked it.
Think about it. That's pretty,
You're a psychiatrist.
right? I don't think a psychiatrist can fix anything in 10 minutes.
It would take me 10 minutes just to get on the couch.
Right? I get on the couch every night.
I'm not getting up.
I get my psychiatric therapy every night.
My dogs. I got
My dogs. How many dogs you got? Two?
Two. I have a Chihuahua and a Maltese.
And they both jump on you?
Oh yeah, both. They're all
Right?
When I come home, it's the best.
Yeah, me too. As soon as I get home, I'm on the couch, kicking my feet up, and my dogs are on my lap. And I'm telling them all about my day.
And they didn't complain.
Oh yeah, they let me complain. And then my female long-hair dachshund gives me that look of, when are you going to go get bagels and cream cheese? That's her favorite, bagels and cream cheese. Bagels and cream cheese. If you're ever up in the Princeton, New Jersey area, the Bagel Nook. Bagel Nook. Best damn bagels. Huh? You know what I'm talking about? Oh yeah, they're the best.
Because the water or something.
They say it's the water, it's the pizza. They say it's the water.
Second Street Bagel in Boca Raton is really good.
Really? They have a,
One place that actually gets water to make that pizza. I don't remember which one.
they get it from New York? Really?
The filtration system, right?
The best pizza I ever had in my life, and I grew up in New York, was in Boca Raton.
Boca?
It's called PZA, Pizza,
How is that the best? So that's the best pizza in your life?
ever had in my life.
Outside of New York?
Ever.
Uh-huh. PZA?
PZZA, Pizza.
Pizza, pizza.
Yeah.
Pizza.
Hello, this is Pizza.
They still around?
Oh yeah, they just opened it 3 months old.
Oh, so they're new.
Brand new.
New in Boca. Pizza. Alright. Oh, look at that herniation just come out of there.
I like
Pretty
the
cool,
thick
huh?
crust New York style. I'm not a Chicago fan.
You know,
I like to fold it down the middle, long ways. This is foldable. And the cheese comes off, but when you fold it, you have to be careful. I like that.
stop talking about food. You're making me hungry.
I was going to ask about Dr. Burndes. You know where that pizza place is located in Boca? I was going to go down there.
It's
And,
on 2nd Street.
2nd Street, he
Boca
said.
Raton.
oh, so that's like near Meisner.
Yeah, it's right there.
Oh, perfect.
Literally, it's right in that. It's right outside of Meisner. It's a street over.
Oh, so it's right next to like the New York grilled cheese.
Yes.
Yes.
No, it's not. It's across the street from that.
Across
Perfect.
the street.
It's across the street. You know that area well.
I do. I lived in Boca for over a decade. I'm gonna hit that place up when I go down there for Christmas.
You can walk from my house to Pizza and the 2nd Street Bagel into that New York grilled cheese. So I walk there and then I get something to eat and walk home.
Sounds dangerous to me. Dangerous for your diet.
Yeah.
The food in Boca, I mean, like, oh my goodness,
Food in Boca is tremendous.
it's incredible. Like Italian food, Mexican food, anything. I mean, like, I had the best grilled cheese in my life in Boca. It's called New York, and it's ironically called New York grilled cheese.
Well, you know where the grilled cheese sandwiches come from, right? Holland.
Oh, really?
Holland. Yeah.
Exactly correct.
Oh yeah.
Where they put
In
mayonnaise on
Holland,
French
holy
fries, too.
crap, man! Grilled cheese is huge in Holland. They have so many different types of grilled cheese too. Different kinds of cheeses, mostly Gouda.
Yeah, I love the Gouda. The
Mm-hmm.
the Gouda.
Yeah. I should know my grandfather was Dutch.
My dad was born in Holland.
Is that right?
All my dad's family. Never
Speaking Sie Deutsch and Dutch is not the same.
No, Speaking Sie Deutsch. Deutsch is German.
Deutsch is
Holland
German.
Dutch. I can speak,
Mm-hmm.
I can speak Dutch.
When you say Specken Sie Deutsch, you're asking in German.
Right.
No, I mean, they're close, you know, and I'm sure the Germans took
You know,
over.
The closest language to English phonetically is a language called Fries. F-R-E-S. Fries is from Friesland, which is the northern part of the polders of Holland, and that language is the closest to the English language.
Huh. I didn't know that. Well, this disc here has a lot more scar tissue. You can see it, the white stuff. Speaking of Gouda, right? This is looking like a lump of Edam cheese. How are we doing on irrigation? Good? Grabber. 5 minutes. Any questions from our audience?
No current questions, but we do have a comment from Canes25 once more on YouTube saying Dr. B knows all about the food.
Absolutely, he does. We ought to give Canes 25 a microphone.
I gotta ask Henry a question. Henry,
Henry,
Yes.
have you ever been to a Mexican restaurant there called Calvados?
Calvados Mexican restaurant in Boca.
I have not been there. Is it was
Everyone's
did they?
talking about it. I have not gone there yet. I have to have, my wife's Mexican, so I have to always make sure I do a little recon before I bring her out to eat.
I'm sure if I pass by it, I'll be like, yes, I remember it, but I can't.
You let me know.
Yeah, I can't put a pin on it. But did they change the name to Uncle Julio's, or am I thinking of something else?
Uncle Julio's in Orlando.
Yeah. Then they're.
I think that's a chain.
Yeah, it's a chain. They had one in Meisner and Boca. But Calvados?
Calvados.
Calvados. I'm gonna look around for that when I go down there for sure. Because I'm like,
Have you
Because
seen
Mexican
my
food's the best.
Calvados lately?
That's in the heart of Meisner.
in the heart of Meisner. Okay.
The south side of Meisner.
Oh.
Runs south-north, whatever, right?
Yeah. I know where like.
Yeah. And then there's a Kapow. Have you been there? The noodle bar? I've only went there once. I was okay.
I'm gonna look for around the.
Almost done.
Yeah, I'm gonna
2
be.
more minutes.
I'll be in that area for Christmas. I'm gonna definitely look around for that. I'm just gonna take a picture, see, like,
Maybe
show
gotta
you
go
what you
to
mean.
Yakitori if you like Japanese fusion. You have a good happy hour. I grew up there, so I know all those places. Okay.
You're making me wish I grew up there,
Yeah, there's a lot of good stuff.
right?
It was a great life. I was a lifeguard there. Fun, good friends, good school. I liked FAU a lot.
Good memories.
Yeah.
Just the last bit right here. Can see the nerve, guys. You see that nerve root? Just at 12 o'clock.
Our house was right on the ocean. When we were up there. Still have it.
Sounds amazing.
Yeah, right on the ocean. Beautiful place. It's right outside of a beautiful mangrove.
Oh yeah?
And it's like a state park.
Grabber.
Yeah.
You're doing great. Almost done. And you guys can see the nerve. right there. You guys see that white thing at 12 o'clock?
Yes, we
That
do.
is the nerve root. We're pretty much done here. We're done.
Nice, I'm sitting on this. Thank you.
Scope off. Great work. Scope use 5. All right. Any questions? If not, we'll wrap this broadcast up.
No current questions.
All right. You guys see the whole surgery was done through a tiny little cut on her back. Outpatient. She's going to go home in an hour. And then I'll see her back in the morning for a quick visit. And then she can travel back to Tennessee. This patient is from Tennessee. We had a South Carolina today, a Tennessee. We had a California, South Carolina, Tennessee, and I think we had a Florida lady from Florida as well. All right. Great job today, team. Next week, we've got a busy schedule as well. We're going to be doing a laminectomy, cervical laminectomy, 1 level, no fusion. If you're interested in watching, that should be on Tuesday, assuming our patient gets medical clearance from the cardiologist. Any questions?
No current questions.
And you guys see the incision right there?
Yes, we do.
7 millimeters, 1/4 inch. All right, thanks, Henry. You can wrap it up.
Copy that.